Consider George, a vibrant 72-year-old who had always prided himself on his daily walks through the park. He'd accepted the creaks and groans of his arthritic knees as part of life's journey. But recently, a new kind of pain began to cast a long shadow over his days. It started as a tight, cramping sensation in his calves that would grip him so intensely after walking just a single block that he'd have to stop, leaning against a tree and pretending to admire the view until the seizing subsided. His doctor initially waved it off. "It's just part of getting older, George. Probably the arthritis." But George knew with a certainty that settled deep in his gut that this was something else. This wasn't the dull, achy complaint of a worn-out joint. This was a fiery, demanding pain that felt like a warning signal, a red flag his body was frantically waving. Then there were the nights where a strange, tingling numbness would creep into his feet, a disquieting sensation like they were falling asleep, except they never truly woke up. He felt increasingly isolated by a condition no one seemed to understand, a pain that was stealing his mobility, his confidence, and his connection to the world he loved. The simple joy of a walk, once his daily meditation, had become a source of dread. George's story is not just a tale of frustration. It's a profound and urgent reminder that not all leg pain after 65 is the inevitable consequence of arthritis. The truth, which can be both shocking and empowering, is that your legs are one of the most honest parts of your body, often providing the earliest and clearest signs of other underlying health issues. The secret to a long, active, and independent life often lies in learning to listen to this language of pain, to decode its messages before a small problem becomes an insurmountable one. In this article, we are going to explore the 4 significant types of leg pain that can occur after 65 that are absolutely not normal arthritis. By the time you finish reading, you will not only understand what these pains are trying to tell you, but you will also be armed with the powerful, actionable knowledge you need to address them, protect your health, and reclaim your vitality. The answers you seek are closer than you think, and we are about to uncover them together. Have you ever found yourself rubbing a deep, persistent ache in your legs, wondering why it feels so different, so much more troubling than the familiar stiffness of arthritis you were told to expect? So many of us step into our later years armed with the knowledge that our joints will ache, that our bodies will change. But what happens when a new, alarming type of pain emerges? A pain that burns, cramps, or shoots down your leg with an intensity that feels utterly alien. As someone who has spent decades guiding individuals through the complexities of aging and well-being at Elderly Guidance, I have sat with countless people just like George. I've listened to their stories, their fears, and their heartbreaking struggles with pains that have been misunderstood or dismissed. The wisdom I want to share with you is born from those experiences and the vast body of research that supports a simple, powerful truth. Knowledge is your greatest tool for navigating the journey of aging with grace and strength. It is my deepest hope that the information that follows will serve as a light on your path. If you find this information valuable, please let me know by commenting number 1. If not, comment number 0 so I can provide better content for you. Now let's begin the crucial work of understanding what your body might be trying to tell you. Let's think about Margaret, a 78-year-old woman who loved tending to her rose garden. For months, she'd been experiencing a peculiar pattern. Every time she walked to the local shop, about 2 blocks away, she would get a severe gripping ache in her thighs and calves. It was so predictable she could almost time it. The pain would build until it was unbearable, and she'd have to sit on a bench. The most baffling part, after just a few minutes of rest, the pain would vanish completely, as if a switch had been flipped. Her muscles, no longer demanding that surge of blood, were satisfied with the trickle they could get through her narrowed arteries. Margaret, like so many others, blamed herself. "I'm just out of shape," she'd say, feeling a pang of embarrassment. She started avoiding walks, sending her grandson for her groceries. Her world began to shrink, all because of this mysterious, predictable pain. This is the insidious nature of claudication. It doesn't just cause physical pain. It creates a cycle of fear and avoidance. You learn to fear the activity that brings the pain, so you become more sedentary. Becoming more sedentary allows the disease to progress and your overall health to decline. Beyond the classic cramping of claudication, PAD can send other, more subtle signals. Your feet might feel unusually cold to the touch, a direct result of poor circulation. The skin on your legs might appear shiny, or have a slightly bluish tinge. You might notice that the hair on your legs has thinned or stopped growing altogether. In more advanced stages, you might even develop sores or ulcers on your feet or toes that are heartbreakingly slow to heal. Again, because the healing components carried in the blood can't reach the injury site in sufficient quantities. The pain can even begin to occur at night, when you're at rest. This rest pain is a more serious sign, often felt in the toes or the ball of the foot, and it can be so severe that it disrupts sleep. Many find a moment of relief only by dangling their foot over the side of the bed, allowing gravity to help pull a little more blood down into the starved tissues. The first, and perhaps one of the most commonly misunderstood, types of leg pain is one that originates not in your joints or bones, but within the very lifelines of your body, your blood vessels. This is vascular pain, and its most frequent culprit in our later years is a condition known as peripheral artery disease, or PAD. It sounds complex, but the concept is quite simple when you think about it. Imagine the arteries in your legs as a series of wide, open highways, designed to carry a constant, powerful flow of oxygen-rich blood from your heart to the tips of your toes. This blood is the fuel that your leg muscles need to do everything, from taking a gentle stroll to climbing a flight of stairs. In a healthy system, the flow is effortless. But as we age, and due to factors like high cholesterol, high blood pressure, or a history of smoking, these highways can begin to narrow. Plaque, a sticky substance made of fat and other materials, starts to build up on the artery walls, creating what is essentially a traffic jam. This process is called atherosclerosis, and when it happens in the limbs, we call it PAD. Now, when you're at rest, even these narrowed arteries might be able to deliver enough blood to meet your muscles' minimal need. But the moment you start moving, your muscles cry out for more fuel, more oxygen. They are working harder and need a bigger delivery. The narrowed, clogged highways simply can't handle the demand. The result is a profound and painful oxygen debt in the muscles, which manifests as the hallmark symptom of PAD, a deep, aching, or cramping pain known as claudication. This isn't a surface-level pain. It's a muscular agony that forces you to stop what you're doing. Recognizing these signs is the first, most powerful step. So, what is the actionable advice here? It begins with a conversation with your healthcare provider, who can perform a simple, painless test called an ankle brachial index, ABI, to compare the blood pressure in your ankles to the pressure in your arms. A lower pressure in your ankles is a clear indicator of narrowed arteries, but the power to fight back is very much in your hands. The single most effective treatment for PAD is something you can start today: a structured walking program. It sounds counterintuitive. Walking is what causes the pain. So why would you do more of it? Think of it this way. When you walk to the point of pain and then rest, you are sending a powerful message to your body. You are creating a demand that encourages your circulatory system to adapt. Over time, your body responds to this challenge by developing tiny new blood vessels that create a natural bypass around the blockages. This is called angiogenesis, and it's your body's own incredible way of healing itself. Start slowly and safely. Walk at a comfortable pace until you feel the onset of moderate pain. On a scale of 1 to 4, a 2 or 3. Stop and rest until the pain is gone. Then start again. Aim for 30 to 45 minutes of this walk-rest-walk cycle, 3 to 5 times a week. Beyond walking, managing the risk factors is crucial. If you smoke, quitting is the most important gift you can give your arteries. Work with your provider to control your blood pressure and cholesterol. And if you have diabetes, diligent blood sugar management is essential. Finally, pay meticulous attention to your feet. Inspect them daily for any cuts, blisters, or sores. Because of the reduced blood flow and potential nerve damage, a small injury can become a major problem if left unnoticed. Always wear comfortable, well-fitting shoes. These actions are not just about managing pain. They are about preventing the most severe complications of PAD, such as stroke or heart attack. Because the same plaque that clogs your leg arteries can also be clogging the arteries to your heart and brain. Addressing the warning signs in your legs is a profound act of self-care for your entire body. The most common cause of peripheral neuropathy in older adults is diabetes. Over many years, high blood sugar levels are toxic to nerves and the small blood vessels that supply them with nutrients, leading to gradual and progressive damage. However, it is a profound mistake to assume neuropathy is only a concern for those with diabetes. It can also be caused by a range of other conditions, including vitamin deficiencies, especially B12, kidney disease, autoimmune disorders, certain medications, and even excessive alcohol consumption. In many cases, no specific cause is ever found, a condition known as idiopathic neuropathy, which can be incredibly frustrating for those who experience it. The symptoms of peripheral neuropathy are notoriously varied and often deeply unsettling because they don't feel like a typical pain. Many people describe it as a burning sensation, a constant, smoldering fire in their feet or legs that can range from a mild warmth to an excruciating branding iron agony. For others, it manifests as a relentless tingling or a pins and needles feeling, as if their limbs are perpetually on the verge of waking up from being asleep. Some feel sharp, stabbing, or shooting pains that come and go with no warning, like jolts of electricity. Perhaps one of the most dangerous and disorienting symptoms is numbness. While the absence of pain might sound appealing, it is a profound loss. Numbness robs you of your connection to the ground beneath you, making your balance precarious and your gait unsteady. It dramatically increases the risk of falls, as your brain is no longer receiving the clear signals it needs to know where your feet are in space. Moving from the circulatory highways of your legs, another powerful and deeply personal type of pain can arise from a different system entirely, the intricate, delicate network of your nerves. Believe it or not, the pain you feel might have nothing to do with blood flow or joint health, but instead be a sign of trouble in your body's electrical wiring. This is neuropathic pain, often caused by a condition called peripheral neuropathy. The word neuropathy simply means nerve damage. Your peripheral nerves are the vast network of nerves that exist outside of your brain and spinal cord, connecting your central nervous system to every other part of your body. They are responsible for sending a constant stream of information back and forth. Sensory nerves tell your brain what you are feeling: hot, cold, sharp, soft. Motor nerves carry signals from your brain to your muscles to make them move. When these nerves become damaged, the signals get distorted, scrambled, or lost entirely. It's like having faulty wiring in your house. A light might flicker for no reason, an appliance might not turn on, or you might get a sudden, unexpected electrical shock. In your body, this translates into some of the most bewildering and distressing sensations a person can experience. The story of David underscores the critical importance of recognizing these strange sensations as the language of nerve damage. The actionable advice for addressing peripheral neuropathy begins with identifying the underlying cause, if possible. A conversation with your healthcare provider is paramount. They can run blood tests to check for vitamin deficiencies, diabetes, and other metabolic issues. Once a cause is identified, treating it is the first order of business. For instance, if a vitamin B12 deficiency is the culprit, supplementation can sometimes halt or even reverse the nerve damage. If diabetes is the cause, strict control of blood sugar is the most powerful tool to prevent the neuropathy from worsening. But what about managing the symptoms themselves? This is where a multifaceted approach becomes essential. For the painful sensations, the burning, tingling, and stabbing, standard over-the-counter pain relievers are often ineffective because the pain isn't coming from a muscle or joint. Instead, specific medications that calm down the overactive nerves are often used. These can include certain types of antidepressants or anti-seizure medications, which have been found to be highly effective at dampening neuropathic pain signals. Let's take a moment to consider David, a 69-year-old retired accountant who didn't have diabetes. For the better part of a year, he had been living with a secret torment. At night, just as he was settling into bed, a terrible burning would ignite in the soles of his feet. It was a deep, searing heat that no amount of kicking off the blankets could quell. During the day, his feet felt strangely numb, like they were wrapped in thick layers of cotton. He found himself stumbling more often and was terrified of tripping on a rug or missing a step on the stair. He couldn't feel the temperature of his bathwater properly and once scalded his foot without realizing it, until he saw the redness later. The most heartbreaking part for David was that his symptoms were invisible. He looked perfectly healthy. When he tried to explain the burning pain to his family, they would offer well-meaning but unhelpful advice like try a different pair of shoes. He felt deeply alone in his suffering, grappling with sensations that felt impossible to describe. His world, once filled with woodworking projects in his garage, became smaller and more hazardous as his confidence in his own body eroded. The loss of sensation meant he couldn't feel the pedals of his lathe properly, and the fear of a fall kept him confined to his armchair for much of the day. Beyond medication, lifestyle modifications are profoundly important. Protecting your feet becomes your most sacred duty. Because you may not be able to feel minor injuries, you must become a vigilant inspector. Check your feet every single day, using a mirror if necessary to look for any blisters, cuts, or sores. Always wear properly fitting, supportive shoes and never walk barefoot, even indoors. You must also focus on fall prevention. Since your sense of balance may be compromised, it's vital to make your home as safe as possible. Remove tripping hazards like throw rugs and electrical cords. Ensure your home is well lit, especially the pathways to the bathroom at night. Installing grab bars in the shower and next to the toilet can provide life-saving stability. Gentle exercise, such as Tai Chi or yoga, can be incredibly beneficial for improving balance and coordination. There are also therapies that can help soothe the agitated nerve. Some people find relief from soaking their feet in cool water, never hot due to the risk of burns, or using topical creams that contain capsaicin or lidocaine to numb the area. The journey with neuropathy is one of management and adaptation. It is about learning to listen to a new, albeit strange, bodily language and responding with care, vigilance, and a proactive approach to safety. By doing so, you can manage the symptoms, prevent dangerous complications, and continue to live a full and engaged life. This phenomenon is incredibly confusing for people. They feel a deep, unrelenting ache in their leg, so they naturally assume the problem must be in the leg. This brings us to the story of Eleanor, an 81-year-old woman whose only complaint was a profound heaviness and aching in both of her legs that got progressively worse the longer she stood or walked. She had very little back pain to speak of, maybe just a mild stiffness she'd always had. But the leg pain was debilitating. It wasn't the sharp cramp of PAD, nor the burning of neuropathy. It was a dull, draining ache accompanied by a feeling of weakness, as if her legs were made of lead and might give out at any moment. She noticed a very peculiar thing. The pain would ease significantly if she leaned forward. When she went grocery shopping, she found immense relief. By leaning over the shopping cart, she would walk through the entire store, comfortable as long as she was hunched over. But the moment she stood up straight to wait in the checkout line, the aching and heaviness would return with a vengeance. This classic shopping cart sign is a major clue for lumbar spinal stenosis. Leaning forward or sitting down temporarily opens up the spinal canal just a little bit, taking some of the pressure off the compressed nerves and providing relief. Standing or walking upright narrows the canal, increasing the pressure and bringing back the symptoms. This type of pain is often called neurogenic claudication, and it's crucial to distinguish it from the vascular claudication caused by PAD. While both cause leg pain with walking, the relief for vascular claudication comes from simply stopping the activity. For spinal stenosis, the relief comes from changing position, specifically by flexing the spine forward. Just as pain can travel through your blood vessels or be broadcast by your nerves, it can also be a deceptive messenger sent from an entirely different location, your spine. This is the third type of non-arthritic leg pain, and it's one of the most frequently misdiagnosed because the problem isn't in your leg at all. This is what we call referred pain, and its most common source in our later years is a condition called lumbar spinal stenosis. To understand this, let's use another analogy. Picture your spinal cord as the main data cable running through your body, and the nerves that branch off to your legs are the smaller wires that plug into it. This entire system is protected by your spinal column, a stack of bones called vertebrae. The hole in the center of each vertebra forms a channel, or canal, that the spinal cord runs through. Spinal stenosis is what happens when this canal in your lower back, the lumbar region, begins to narrow. Over decades of life, the ligaments of the spine can thicken, discs between the vertebrae can bulge, and bone spurs can form as a result of osteoarthritis in the spine. All of this encroaches on the space available for the spinal cord and the nerves that branch out from it. It's like a tunnel slowly getting smaller and smaller, eventually starting to squeeze the traffic your nerves that passes through it. When these nerves that travel down to your legs get compressed or pinched, they become irritated and inflamed. And when a nerve is irritated at its root in the spine, it doesn't just cause back pain, it sends distress signals all the way down its entire length. so you end up feeling pain, weakness, or numbness in your buttocks, thighs, or calves, even if your back feels perfectly fine. If you are still reading and finding these lessons useful, please comment number 3 below to let me know you are on this journey with me. Thank you for your valuable time. Pain management is also a key component. This can range from over-the-counter anti-inflammatory medications to more targeted treatments like epidural steroid injections. An injection can deliver a powerful anti-inflammatory medication directly to the source of the problem in the spine, bathing the irritated nerves in a soothing solution that can provide significant, albeit often temporary relief from the leg pain. This can create a crucial window of opportunity, reducing the pain enough for you to engage more effectively in your physical therapy program, which provides the longer-term benefits. Positional strategies are also a powerful form of self-care. Pay attention to what your body is telling you. If leaning forward helps, embrace it. When you walk, use a walker or a shopping cart to maintain that slight forward flexion. When you sit, choose chairs that are comfortable and supportive, perhaps reclining slightly. Many people find relief from sleeping on their side with a pillow between their knees, which keeps the spine in a more open and neutral position. While the thought of surgery can be frightening, it is important to know that for severe cases that don't respond to conservative treatments, surgical procedures to decompress the nerves can be incredibly effective at relieving the leg pain and restoring mobility. The key takeaway is that you do not have to live with this debilitating leg pain. By understanding that its origin may lie in your back, you can seek the right kind of help and take proactive steps to manage the root cause, freeing yourself from the baffling and frustrating cycle of referred pain. The pain from spinal stenosis or a related issue like sciatica, where a single nerve root is compressed, often by a herniated disc, can manifest in various ways. It might be an ache, a cramp, a tingling sensation, or even a shooting pain that travels down a specific path, often down the back or side of the leg. This classic sciatic pain feels very different from the more diffuse aching of stenosis that often affects both legs. The actionable advice for dealing with suspected referred pain from the spine is, once again, to start with a thorough evaluation from your healthcare provider. An MRI or CT scan can clearly show the narrowing of the spinal canal and confirm the diagnosis. Once you know what you're dealing with, a world of effective, non-surgical treatments opens up. The cornerstone of management is physical therapy. A skilled therapist can teach you a specific set of exercises designed to strengthen the supporting muscles of your core and back, and most importantly, stretches that promote spinal flexion, that forward-leaning posture that brings relief. These exercises are not about becoming a contortionist. They are gentle, targeted movements that help to create more space for your nerves and reduce inflammation. Finally, we arrive at our fourth category of leg pain, one that is often dismissed as a minor nuisance, but can be a sign of significant underlying issues, pain originating from the muscles and their supportive soft tissues. This is distinct from the wear and tear of arthritis and the systemic problems of vascular or nerve disease. This is about the health and resilience of the muscles themselves, and it can manifest in ways that are both acute and chronic. As we age, our bodies undergo a natural process called sarcopenia, which is the gradual loss of muscle mass and strength. This doesn't just mean we can't lift as much as we used to. It means the muscles we have are less resilient, more prone to injury, and slower to recover. This sets the stage for a variety of painful conditions. One of the most common is a simple muscle strain. You might not have done anything dramatic, no sudden athletic feat. It could be something as simple as stepping off a curb awkwardly, or lifting a bag of groceries with poor form. Because the muscle tissue is less elastic and has less reserve capacity, it can tear more easily, leading to a painful strain, most commonly in the calf or hamstring. This pain is typically sharp at the moment of injury, and then settles into a deep, persistent ache that is tender to the touch and worsens with movement. Let's think about Arthur, a cheerful 85-year-old widower who lived independently. His biggest complaint was the nightly terror of leg cramps. 2 or 3 times a night, he would be violently awakened by a cramp in his calf, so intense it would make him cry out. The muscle would seize into a painful ball, and he would have to hobble out of bed and try to stretch it out, his heart pounding from the shock and the pain. The residual soreness would last well into the next day, making him feel tired and frail. He was becoming afraid to go to sleep. His doctor had told him to drink more water and eat a banana every day for the potassium, which he did diligently, but the cramps persisted. The lack of sleep was taking a heavy toll on his mood and his energy levels. Arthur's story is a profound example of how what seems like a simple muscle problem can dramatically impact one's quality of life and signal a more complex issue. His cramps weren't just a nuisance. They were his body's desperate scream for a better balance of hydration and minerals, likely exacerbated by one of the medications he was taking. Another source of soft tissue pain is tendinopathy. Tendons are the tough, fibrous cords that attach your muscles to your bones. With decades of use, these tendons can undergo degenerative changes, becoming less flexible and more susceptible to microscopic tears and inflammation. Achilles tendinopathy, for example, causes pain and stiffness in the back of the heel and lower calf, particularly in the morning or after periods of rest. Patellar tendinopathy can cause pain just below the kneecap. This is not arthritis pain from within the joint, but pain from the supportive structures around it, and it requires a different approach to healing. Perhaps the most dramatic and alarming form of muscular pain, however, is the severe leg cramp. We're not talking about the occasional Charlie horse you might get after a long day. We are talking about excruciating involuntary muscle contractions that can jolt you from a deep sleep, leaving your calf or foot muscle in a rock-hard, agonizing knot. While occasional cramps can be benign, frequent severe cramps after the age of 65 can be a powerful red flag for deeper imbalances in the body. They are often a signal of dehydration or, more specifically, an imbalance in your electrolytes, the crucial minerals like potassium, magnesium, and calcium that your muscles need to contract and relax properly. As we get older, our sense of thirst can diminish, making it easier to become dehydrated without realizing it. Furthermore, many common medications such as diuretics, water pills used to treat high blood pressure, can deplete the body's stores of these essential minerals, directly leading to an increased risk of severe cramping. The actionable advice for these musculoskeletal pains is wonderfully practical and empowering. For acute strains, the classic RIC method, rest, ice compression, and elevation, is still the gold standard in the first 48 hours to reduce swelling and pain. After that, gentle stretching and a gradual return to activity are key. The goal is to allow the muscle to heal without letting it get overly stiff. For chronic issues like tendinopathy, the focus shifts to targeted strengthening exercises. A physical therapist can show you specific, often eccentric, exercises where the muscle lengthens under load that are proven to stimulate healing and remodeling in the damaged tendon. Now, for the critical issue of severe cramps, the investigation must go deep. Start by meticulously tracking your fluid intake. Don't rely on thirst alone. Aim to sip water consistently throughout the day. Look at your diet. Are you eating a rich variety of foods that contain magnesium, leafy greens, nuts, seeds, potassium, bananas, sweet potatoes, avocados, and calcium, dairy products? Fortified foods. Most importantly, have an open conversation with your healthcare provider or pharmacist. Ask them to review your full list of medications to see if any of them could be contributing to electrolyte imbalances. A simple blood test can reveal any significant deficiencies, which can then be corrected with dietary changes or supplements under medical guidance. Proactive muscle care is also essential. Gentle, regular stretching, especially before bed, can help to keep the calf and foot muscles pliable. A simple wall stretch for your calves for 30 seconds on each side can work wonders. Staying active with gentle exercises like walking or swimming keeps your muscles strong and healthy, making them less prone to both injury and cramping. Understanding that your muscles have new needs in your later years allows you to provide them with the right care, turning what feels like a nightly torment or a persistent ache into a manageable condition and restoring your comfort and your confidence. So, what have you learned so far on this journey through the often misunderstood landscape of leg pain? As we've explored these four powerful signs, the circulatory warnings of vascular pain, the strange broadcasts of nerve pain, the deceptive messages from your spine, and the urgent needs of your muscles, what is one thing you plan to bring into practice in your own life? Is it to finally schedule that conversation with your provider about the cramping in your calves? Is it to be more vigilant about checking your feet, to start a gentle walking program, or to ask about physical therapy for that ache that comes on when you stand? Please share your answer in the comments below. Your story, your insights, and your commitment to your own health are an invaluable part of this community, And your experience may be the very thing that inspires someone else to take action. And if this article has resonated with you, if it has shed a light on something you've been struggling with, I encourage you to share it with your friends, your family, or anyone in your life who might benefit from this wisdom. Thank you for entrusting me with your time. Remember to listen to your body with compassion and curiosity, and to live your best life, one filled with health, resilience, connection, and profound joy.